Okay, good afternoon, everybody, and thanks for joining us again. First, I want to thank everybody in the community for your steadfast support with all of the social distancing rules that have been in place and the public health orders. Your efforts have really continued to make an incredible difference in the rate of transmission within our communities. And I think you've shown the country once again that St. Louis can lead the way in dealing with the pandemic and coming together as a community to really fight this virus. So let me show you a couple of slides again today. We see here in our moving 7-day average rate of hospitalizations that the curve has flattened from the rapid increase that we saw at the beginning of April. And the number of COVID patients and patients under investigation have gone down. They're 685 today, which is down from 702. But what we really are starting to look at now is that moving average. And so as you can see, it's very encouraging. It has flattened out from that steep part of the curve that we saw earlier in the month. And of course, we'd love to see it go down even faster, but we're also glad that it's not increasing either. So let me show you a couple of other slides here, some high-level modeling things that we've spoken about in the past about our task force modeling. And we continue to see some steady improvement in the direction of our data. So first let me show you the actual hospitalizations. And so this is taking us up to April 5th, which is when, as you know, we started our briefings. And that's our light blue line here. And this data includes, again, COVID positive patients. So it's a little bit different than what we brief on a daily basis, because this just includes patients that were diagnosed with COVID, not the ones that we suspected of COVID. So it's a more precise number. It's a little bit different than the numbers that we show you every day, but directionally it's the same. Now the orange line here, if you remember from when we shared these models with you a week or so ago, that's our worst case scenario. So this is the model that we used, and it was based off of what we saw was going on in Europe, and then applying that slope to what we thought would occur in St. Louis, given the same conditions. And so what I want people to take away from this is, if you compare the blue and the orange lines, we were on track for that worst case scenario. But something happened, and it was right at around April 5th, and that's where we took that right-hand turn and started to flatten out the curve. And if you march the dates back, it marches back to when those shelter-in-place orders were really put in place, and we started to suppress the curve. And so that was really good news. We started to flatten the curve, and we started to see reduced hospitalizations. And then lastly, let me show you what we call our reasonable best guess curve is. And this model is a little bit different than the orange line because it's using actual data from the St. Louis metropolitan area. And the thing that I want you to take away from this line is that the blue line is tracking pretty well with the white line. And so we're fairly confident in the numbers that we're seeing projected going forward from this line. And of course, that assumes that everything remains the same, that transmission stays low, that people are doing all of those things, sheltering in place, social distancing, all of those different things. But it does give us, we're cautiously optimistic that we will continue down this curve and start seeing increased improvements in the census numbers for our hospitalizations. And so what does this mean? This gives us confidence then that we can start planning for reopening the economy, loosening some of those social restrictions because these numbers have been tracking so well with the model. But remember, this is a big if. Hospitalizations are what we call a lagging metric. So what is occurring in the community right now as far as transmission of the virus isn't going to show up for 7, 10, 14 days because people have to get sick, admitted to the hospital, and that's when they reach our data. So we in healthcare, and in the healthcare community, we understand the urgent need to get our economy back up and moving again as well. And we're committed to working with our elected officials, with our public health officials, with businesses and others to do that in a really safe and gradual way. Big parts of those, as I've talked about before, are testing, contact tracing, social distancing, and those are all crucial for this gradual process. And our healthcare systems really stand ready to support all of that work that our public health officials are going to be doing as they're really leading this effort. So let's move on now to today's numbers. So as you can see here, we currently have 685 hospitalizations. And again, these are COVID positive plus COVID suspected patients or patients under investigation. And that's down from 702 that we had yesterday. And again, these numbers are going to fluctuate day to day, but it's that trend that we're looking at. Now there's 164 patients in our intensive care units, which is about the same as yesterday when we had 160. And there's 117 patients on ventilators right now, which is down from 121, which we had yesterday. And now the good news. Another 51 COVID patients were discharged yesterday, which brings us up to 1,260 patients who have been discharged from our hospitals since our first confirmed COVID positive patient. So again, I just want to reiterate, we're doing much better than when we started out on this journey on April 5th. Remember, we were on that worst case model curve, but because of all the hard work, because of really those courageous decisions that our local officials made with shelter in place, because of the continued due diligence of our community in complying with social distancing, hand washing, cleaning surfaces, all of those other steps, that really stopped the spread and ultimately really did save lives. And I don't want to underestimate that. You can draw a direct correlation to decreasing transmission and saving lives. So what we need to do now, we need to continue to do those same things. The goals are to keep transmission low. We can begin to gradually reopen the economy, but the goal has always got to be keeping transmission low. And that's doing all of the things that we're currently doing while relaxing some of the restrictions. And that's how we can safely and gradually open back the economy. And so with that, I'm done with my briefing, and we'll go now to questions from the media.
Are the daily new COVID-19 cases in the St. Louis area coming from household or family contact or from community contact?
Hard to say. It's challenging sometimes to say where people pick up the virus from, unless it's within like a communal living or like a nursing home type atmosphere. And so it's challenging to say whether those come from a family contact or from a community contact. I don't think anybody could really tell you that with any degree of certainty. So it's just challenging to say how spread is occurring within the community.
What do you think about the state of Missouri reopening on Monday and the pressure on County Executive Page to reopen St. Louis County?
Well, so I think, the mayor and the county executive are doing exactly the right things with looking at the data that is pertinent to the metro area. The governor opening up the rest of the state, even he acknowledged that the St. Louis metropolitan area is different from the rest of the state. And I think it's a fair assumption to say that regions are a little bit different. Certainly St. Louis is different than New York, which is different than Seattle and LA. And so in some ways it's not that much different when you're comparing the St. Louis metropolitan area with maybe some more rural areas of the state. And so it's always a balance. Like I said, there's no perfect answer to this. And so trying to seek a perfect answer is really a fool's errand.
Do you think that reopening the state is a responsible thing to do? And when do you think it should happen?
I'll just reiterate what I said previously. The decisions on when to open up the economy and to loosen restrictions has to be a balance between those public health measures and the needs for the economy, as well as the need for people as well. And so what you just want to happen is to make sure you have all of those tools in place so that you can keep transmission low. So I've said before, the date isn't as important as understanding all of the tools that you need to keep transmission low, as well as those other things that we as a community need to practice, whether that's hand hygiene, wearing masks out in public, keeping surfaces clean. Those are really the key things. The date, it's a place and time. Yes, we would like to see transmission get as low as possible before we do some of these things. But at the end of the day, if we can do all of those other things, those public health measures and those other personal things to keep transmission low, those are the important things.
You have mentioned that testing doesn't do much good if contact tracing, isolation, and quarantine are not happening as well. Do you feel that those other elements are being focused on locally?
I do. I speak with public health on a fairly frequent basis, and I know that that's been front and foremost in their minds is the testing, the contact tracing, isolation, quarantine, all of those different measures. I mean, they understand they do this on a daily basis, not just for COVID, but for other communicable diseases. So they understand this business, and they understand how to do it and how to do it well. And so yes, I believe they are putting the attention to it.
What about statewide?
Statewide, I have a little bit more clarity on the local area, more so than statewide. I would just base my thoughts on what we hear from the governor and from state health officials, that this is what they're focusing on, and I can only assume that that's true.
Thank you. That concludes the list of questions received from members of the media prior to and during the briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you.